Breathing in and breathing out is a psychosomatically controlled process. Transformation of breathing out into breathing out accompanied by voice is a genetically encoded unconditioned act. To be able to use the factor of breathing out accompanied by voice, it must be always preceded by the act of breathing in. There is no need of taking a deep breath to achieve a loud speech. With a little breathing in or with the rest of the breathing out, it is possible to say just a syllable or a word, and then you can take another breath. We usually speak after taking a proper breathing in. In fact, stuttering has nothing to do with incorrect breathing. It is just a misleading information. The cooperation between the breathing and the speech is of psychosomatic character. When reading, narrating, acting and so on, we often have to deliver long sentences. Sometimes we even don't use up all of the deep breath. We can finish the breathing out or can have another breathing in. When speaking in public, we don't pay attention to the breathing in and out. This is the most inventive finding of the Neurologos Therapy. The animation on the right shows speech with the genetically encoded info and cortical subconscious. The animation on the left shows speech with the genetically decoded info and cortical subconscious. The move of fingers represents the defective and non-defective cortical subconscious. The animation on the right shows speech with the genetically encoded info and cortical subconscious. The aspect of the false vocal folds, the aspect of the true vocal folds and the aspect of the breathing out get activated in a 1 millisecond synchronization. The factor of breathing out, 1 millisecond, prevents the false vocal folds, 1 millisecond, from going into a closure, thus making it possible for the true vocal folds, 1 millisecond, to start oscillating. The animation on the left shows speech with the genetically decoded inborn cortical subconscious. The aspect of the false vocal folds, the aspect of the true vocal folds and the aspect of the breathing out are not activated in a 1 millisecond synchronization here. Both the factor of breathing out and the factor of oscillating of the true vocal folds get delayed by 0.3 of a second behind the false vocal folds that get ready within a 1,000th of a second. The false vocal folds are missing an expiratory distance, and so they turn into a closure, like in the act of swallowing. The classic stuttering occurs depending on this delay.